Hello everyone. Today I am going to describe the topic of COVID-19 and here is my presentation. So I'm going to describe these things in this presentation is symptoms, transmissions, risk factors and diagnosis. So what is COVID-19 and is COVID-19 affects different people in different ways. Most infected people develop mild to moderate illness and recover without hospitalization. And as well as all know, in December 2019, these reports a novel coronavirus, since named SARS-CoV-2, its 2 variant, emerged from Wuhan, Central Hubei province, China. Other coronavirus COVs includes the SARS-CoV and the MERS-CoV have previously emerged as epidemic and significant mortality and socio-economic impact. Consequently, there is a concern that IBD patients are at greater risk of developing COVID-19 and at increased risk of progressing to a more severe clinical course or even death compared to the general population. In addition, if an IBD patient develops COVID-19, there is a lack of guidance on medication management and concern regarding drug interactions if trial medications are utilized to treat COVID-19. And there are the most common symptoms of COVID-19 observed in patients, and the most common symptoms that COVID-19 develops in a person is fever, cough, tiredness or loss of taste or smell. The major clinical manifestations of COVID-19 are fever 44% on admission and 89% during admission. Dry cough is 68%. Shortness of breath is 19%. Diarrhea or vomiting, abdominal pain is near 20%. Generalized myalgia or arthralgia 15%. Headache 14%. Malaise and bilateral intestinal pneumonia. While the mechanism of COVID-19 induced gastrointestinal symptoms remains to be clarified, enteric symptoms may occur due to malabsorption secondary to direct damage of invaded electrolyte in the setting of viral infection. Furthermore, there is a recent case report of possible SARS-CoV-2 gastrointestinal infection causing acute hemorrhagic colitis and signaling COVID-19 disease. Moreover, the less common symptoms that are observed are sore throat, headaches, aches and pain, or diarrhea, rash on skin or discoloration of fingers or toes, and red or irritated eyes. And now discussing how it transmits from one to another. Human to human transmission is believed to predominantly via direct contact, exhaled droplets, and vomitus from an infected individual. SARS-CoV-2 can also be detected in saliva, urine, and gastrointestinal tract in both biopsy specimens and stools. Although the role in transmission remains unclear, it is more easily transmitted than seasonal influenza based on a basic reproduction number. Entry of coronavirus into human target cells require spike protein binding to a cellular respirator followed by S protein primary by host protease to facilitate cell entry. Middle Eastern Respiratory Syndrome coronavirus MERS-CoV and Severe Acute Respiratory Syndrome coronavirus SARS-CoV-2. These viruses are all known to cause respiratory symptoms ranging by broadly and severity both between the different viruses and in different hosts infected with the same viruses. SARS-CoV-2 virus, the most spread easily and resulted in relatively mild illness in immunocompetent patients, with certain strains being responsible for almost 30% of common cold. And the risk factors for contracting COVID-19 have been fully elucidated, and healthcare professionals are at greater risk secondary to increased exposure, and it is through that smoking may exacerbate contraction. For all patients with COVID-19, severity and mortality and associated with age, median age is 66 years for critically ill versus 51 years in the overall patient population. An underlying cardiovascular disease, hypertension, chronic pulmonary disease, diabetes, and cancer. Severe COVID-19 is less common in children, with reports suggesting approximately 5% develop severe disease and 0.6% become critical. The crude fatality rate is higher in males, 4.7% versus females, 2.8%, and smokers. Possible risk factors for COVID-19 infection: smoke, healthcare worker, nursing home, community living environment. Possible risk factors for developing severe critical COVID-19 is age, more than 50, diabetes, hypertension, malignancy, COPD, smoking, lymphopenia, neutropenia, higher LDH and D dinner levels on admission, post-operative sitting, corticosteroids, and diarrhea. Further risk factors for death if admitted to: tachycardia, lymphopenia, hypoxia, coagulopathy. A diagnosis of COVID-19 should be considered in patients who display fever, cough, insomnia, nausea, vomiting, and diarrhea. Of note, a subgroup of patients may present with mild disease marked by the presence of diarrhea initially, and these patients often experience delayed diagnosis compared to those that present with respiratory symptoms. Recommendations on whom to test COVID-19 will vary depending on the local guidelines, availability of testing kits, and regional transmission dynamics. In high-risk setting where an outbreak has occurred, all patients with clinical features consist with COVID-19 should be considered for testing. In non-outbreak areas, a case of COVID-19 should be suspected and tested for if a patient has clinical features suggestive of COVID-19 and fits epidemiologic criteria, for example, international travel or contact with confirmed COVID-19 case. A patient is also considered a suspected case of COVID-19 of their history, if they are admitted to hospital with acute respiratory illness or unexplained fever. That's all with my presentation, and here are the references used. Thank you.